pre-implant functional magnetic resonance imaging as neuroimaging predictor for cochlear implant outcomes, presented by Salma Hassan, consultant of phoniatrics, Ain Shams General Hospital. The CI team faces a challenging task of providing parents with appropriate expectations for oral language outcomes with the implant. Various behavioral tests are administered post-implantation to measure speech, language, and hearing performance of infants and toddlers. However, an objective tool that accurately predicts post-implant oral language performance before CI in infant is still lacking. Better prognostic indicators are required to provide clinicians and parents with calibrated expectations for speech and language outcome in such cases. As we know, we have many factors affecting outcomes in CI recipients. Some of them as we said in the panel. We have a lot of factors like duration of severe to profound hearing loss, age severe and profound hearing loss, the cause of hearing loss, and so on. However, among patients with identical factor, performance remain highly variable, suggesting that there are some other more fundamental factors that determine clinical outcomes. Clinical outcomes of the cochlear implant, we assess hearing and speech perception, oral language performance. Post-implantation assessment, a follow-up audiological test battery, and as we have in phoniatric units, the follow-up language and speech test to assess receptive and expressive language skills, speech pattern acquisition, verbal interaction ability. Neuroimaging biomarkers. The development of functional imaging approach that offer a view of brain activity was one of the most exciting advances in the brain imaging over the past 30 years. Functional MRI procedure require an individual to perform specific tasks such as naming picture objects, listening to story while lying in the MRI scanner. Functional imaging are collected repeatedly while tasks of interest are performed, and the data are reconstructed to reflect blood flow changes over time. MRI is non-invasive and have no known risk if operated with the specified limits. Functional MRI makes use of blood oxygen level dependent contrast to measure brain activity indirectly through changes in blood oxygenation that accompany neuronal activity. When an area of the brain is in use, blood flow to that region also increase. As we see in this picture, the resulting brain activation can be graphically represented by color coding the strength of activation across the brain or specific region studied. The blue color means hypoactivity, and the red color, which is hotspot, means hyperactivity. Neuroimaging of the language. A number of studies have analyzed language recognition, understanding, and production, usually using a functional MRI. Receptive language. Sorry. The processing of speech correlates with significant activation in the primary auditory area and adjacent cortical zones. The posterior part of planum temporal, it's observed that this area become activated with sequence of syllables and are heard, and in the phonological recognition of the language. As we see in this picture, this is the real picture for 7 years old right-handed boy, showing the transverse cut for at the level of planum temporal or auditory cortex. We show that we have bilaterally represented area of language. The greater extent and intensity is on the left side, particularly toward the planum temporal. Receptive language. Receptive language, as we know, it's in the brain, we call it vernix area. The superior temporal gyrus corresponding to Brodmann area 22 has been considered as the most crucial area in generally language comprehension. Word understanding, in particular in left hemisphere, in semantic processing, selective attention to speech, processing complex sounds, lexicosemantic access to melodic representation. Receptive language, we have now more wider extended vernix area, Brodmann area 20, Brodmann area 37, 38, 39, and 40. Expressive language, language production has been classically related with the Broca's area activity corresponding to Brodmann area 44 and 45. Brodmann area 44 has demonstrated to be involved in a diversity of verbal function: verbal fluency, phonological processing, grammar processing, attention in speech, sentence comprehension. Expressive language, meta-analytic studies have suggested that Brodmann area 44 and 45, 47, and 6 participants participate in kind of frontal language production system or Broca's system. Also, we have lenticular nucleus and the thalamus, which correlates to expressive language, and the insula's direct involvement in the linguistic process, which is responsible for word generation, naming, and phonological discrimination. How can we do functional MRI conducted to the toddler CI candidates? Potential CI candidates should be referred to the radiology department for MRI of the auditory nerve to ensure structural integrity and to rule out any other brain abnormality. The functional MRI experiment was conducted at the end of the clinical MRI after the MRI images. No infant was exposed to the risk of anesthesia solely for research purpose. The aim of presentation to identify objective neuroimaging biomarkers that might predict speech perception and oral language performance in young CI recipients. To identify the relationship between the functional MRI signal in brain region related to auditory language processing in infants with congenital severe to profound hearing loss before cochlear implantation and their scores on tests of speech perception and oral language ability after cochlear implantation. Functional MRI procedure. I want to skip this area and to summarize what the idea. The idea that we introduced 3 auditory stimulus as narrowband noise and speech and silence. And we have 3 contrasts: story versus silence, narrowband noise versus silence, and story versus noise. We introduce all of them at 5 seconds, equal duration, and we have to assess the brain function by the scanning and acquisition of the pictures for 6 seconds. This alteration of stimuli reduced the effect of scanner noise and measured brain activity. Story versus noise contrast, the composite of a map of the story versus a noise contrast didn't reveal activation in temporal, frontal, or limbic lobes. This lack of activation may be attributed to constellation of activation in similar brain region in response to 2 auditory stimuli. Story versus silence contrast, the right angular gyrus, left medial frontal gyrus, and left cingulate gyrus correlated significantly with post-implant oral language abilities as measured by language tests. Noise versus silence, significant correlation between pre-implant, noise silence contrast, and post-implant language scores. Only 1 cluster correlated significantly with language test. The centroid of this cluster fell in the angular gyrus in the left parietal lobe. The difference between noise and speech processing is the speech is more complex and need a wider area of the brain to be hyperactive. So I will skip to the to the time. Difference between a noise. Okay. Thank you. هو قفلوا هم اللي قفلوا لوحده. اوكي. أنا كنت عايزة أقول conclusion بس. مفيش. اوكي. Thank you. حاضر. هو بس بيظبط حاجة. Wait, only one. Conclusion, the presentation explored the relationship between pre-implant functional MRI activation and post-implant oral language development. Positive correlation suggests the greater pre-implant activation in the angular gyrus, cingulate gyrus, and the area in the prefrontal cortex and supramarginal gyrus will be indicative of better post-implant language development in infants and toddlers receiving CIs, although young children with severe to profound hearing loss will continue to receive CIs irrespective of their cortical activation level. An effective neuroimaging biomarker could help guide clinical decision for CI team, including audiologists and phoniatricians. Thank you.